Chronic cough, causes and symptoms. Coughing is a routine bodily function, but when it lasts for an extended time, it can get in the way of everyday life and be boring. A chronic cough can be wet and produce phlegm, or dry and tickle the throat. A chronic cough is when a cough lasts longer than 8 weeks in adults or 4 weeks in children. Common causes include asthma, allergies, gastroesophageal reflux disease or GERD, or bronchitis. Less commonly, it can be a sign of a more severe condition such as a heart cough or lung disease. What causes a chronic cough? A variety of factors can cause a chronic cough. Sometimes more than one factor may be responsible. Common causes. Some of the more common causes of chronic cough include asthma. Asthma occurs when a person's upper airways are especially sensitive to cold air, irritants in the air, or exercise. One type of asthma, known as cough variant asthma, specifically causes a cough. Bronchitis. Chronic bronchitis causes long-term inflammation of the airways that can cause a cough. This can be a part of an airway disease called chronic obstructive pulmonary disease or COPD that typically occurs as a side effect of smoking. Gastroesophageal reflux disease or GERD. GERD occurs when acid comes back up from a person's stomach and into their throat. The result can be chronic irritation in the throat that leads to a cough. Lingering after effects of infection. If a person has had a severe infection such as pneumonia or the flu, they might still experience lingering effects that include a chronic cough. Even though most of their symptoms have gone away, the airways may still remain inflamed for some time. Postnasal drip, also known as upper airway cough syndrome. A postnasal drip is the result of mucus dripping down the back of the throat. This irritates the throat and triggers a cough reflex. Blood pressure lowering medications. Medications can cause a chronic cough in some people. Less common causes. Some less common causes of a chronic cough include aspiration. Aspiration is a medical term for when food or saliva goes down the airways instead of the food pipe. The excess fluid can collect bacteria or viruses and may lead to irritation of the airway. Sometimes aspiration can lead to pneumonia. Bronchiectasis. Excess mucus production can cause the airways to become larger than normal. Bronchiolitis. Bronchiolitis is a common condition that affects children. It is caused by a virus that causes inflammation of the bronchioles, which are small airways in the lungs. Cystic fibrosis. Cystic fibrosis causes excess mucus in the lungs and airways, which can cause a chronic cough. Heart disease. Sometimes coughing and shortness of breath can be symptoms of heart disease or heart failure. This is called a heart cough. A person with this condition may notice their cough worsens when they are lying completely flat. Lung cancer. While rare, persistent coughing can be a sign of lung cancer. A person with this disease may also experience chest pain as well as blood in their sputum. Sarcoidosis. This is an inflammatory disorder that causes small growths to develop in the lungs, lymph nodes, eyes, and skin. Symptoms. A cough is typically the result of something that is irritating the airways, causing the muscles in the chest and stomach to contract. The irritation also causes the glottis that covers the airways to open quickly, causing air to rush out. The result is a cough. A cough can be dry or wet. A dry cough is a non-productive one meaning the cough does not produce mucus. People who smoke cigarettes and those who take ACE inhibitors tend to have a dry cough. A wet cough is one that produces mucus or sputum. This is the case when, for example, a person has postnasal drip or cystic fibrosis. Risk factors and complications. Smoking cigarettes can increase the risk of developing a chronic cough. Exposure to second-hand smoke can also increase a person's risk. The smoke can irritate the airways and lead to a chronic cough as well as lung damage. Exposure to chemicals in the air, such as from working in a factory or laboratory, can also lead to long-term coughing. Complications. Coughing can be problematic if it interferes with a person's daily life. A chronic cough can have the following additional effects: affecting a person's ability to sleep well if coughing keeps them up at night, daytime fatigue, difficulty concentrating at work and school, headaches, dizziness. Although rare, very severe coughing can cause the following complications: fainting, urinary incontinence, broken ribs. Going to see a doctor. A chronic cough can become a medical emergency. If a person experiences the following symptoms along with a chronic cough, they should seek emergency treatment: a fever greater than 103 Fahrenheit, coughing up blood, chest pain, shortness of breath, or difficulty catching their breath. If a chronic cough interferes with a person's everyday activities, it often warrants further examination by a doctor. Other symptoms that may mean a person needs to see their doctor include appetite loss, coughing up a lot of mucus, fatigue, night sweats, unexplained weight loss.